in the recent years, examiners are getting bored of asking one-liner type of questions, so they are asking clinical, lengthy questions with important buzzwords. In this video, we are going to see all such important diseases and their buzzwords. So watch this video till the end. Hello dear students, myself Dr. Maddineni Srinivas. Welcome to Crack DrMSD. If you have not yet subscribed to my channel, please do subscribe so that you are going to get awesome content like this in the future also. So let us begin our discussion with the first disease, which is acrodermatitis enteropathica. So can you tell me what is the deficiency which is producing this condition? If you know the answer, put it in the comments. So there's going to be a triad of, obviously this is a video of triad. So periorifacial dermatitis will be seen. As you can see here, all the orifices, you can see there's going to be some kind of eczematous skin changes, and there's going to be loss of the hair over the scalp, so it is called as alopecia, and there's going to be complaints of diarrhea. This is the triad we are going to see in acrodermatitis enteropathica, and if you have marked the answer in the comments as zinc, absolutely correct. Yes, zinc deficiency is associated with acrodermatitis enteropathica. Next is the atopic triad. We are going to see this in atopic dermatitis, which is also called as atopic eczema, and there's going to be other feature related to respiratory tract. So upper respiratory tract involvement, allergic rhinitis, or it is also called as hay fever, and lower respiratory tract involvement in the form of bronchial asthma. So basically this is a type 1 hypersensitivity reaction, atopic triad. So next I will give you these three features. You need to tell me what is the syndrome seen associated with this triad. So recurrent aphthous stomatitis, aphthous ulcers, recurrent genital ulcers, specifically the ulcers are present over the scrotum, and there is eye manifestations in the form of inflammatory changes in the iris and also in the retina. So can you tell me what is the name of this syndrome? If you have thought of this name as Behçet syndrome, you are absolutely correct. Very good. Next is Church-Strauss syndrome. So this is also called as allergic granulomatosis. In this, there is going to be necrotizing vasculitis with extravascular granulomas, lower respiratory tract involvement in the form of asthma, and also peripheral blood is going to show eosinophilia. Basically, there is going to be increased eosinophil count in these patients. First, let us see the follicular occlusion triad. So this is related to mainly the glands. Okay, so there is going to be the severe form of the acne, which is called as the acne conglobata, and there is going to be hidradenitis suppurativa, which is the blockage of the apocrine ducts, mainly in the axial area on the groin. So you can see the patients are going to have these kind of nodular lesions, and also there can be scarring. Next is the scarring alopecia of the scalp. Specifically, it is called as dissecting cellulitis of the scalp. So these three features put together, the triad is called as follicular occlusion triad. And if there is one more feature added, that is the pilonidal sinus, we are going to call it as a tetrad. So this is a small difference between triad and tetrad. Next is the Graves disease. We are going to have this Diamond's triad. So what is this? The patients are going to have the pretibial myxedema will be there, and there is going to be thyroid acropathy with clubbing, and also there is going to be exophthalmos. So these three features put together, we call it as Diamond's triad, and seen in the Graves disease, hyperthyroidism. So next I will give you the clue. You need to tell me what is the name of this syndrome. Patient is having hyperandrogenism in the blood, and there is insulin resistance, and also there is acanthosis nigricans, that is velvety texture present in the skin folds. So what is the syndrome? If you have thought of the answer as Hyran syndrome, you are absolutely correct. Very good, very good. Okay. So next we are going to discuss the Hand-Schüller-Christian disease. So name is very complex, isn't it? It is a Langerhans histiocytosis basically, in which there is going to be a triad of, in the skin we can see the osteolytic bone lesions literally producing skin ulcers. The patients are also going to have exophthalmos, and there is going to be diabetes insipidus. So this is Hand-Schüller-Christian disease. Next is a syndrome. You need to tell me the answer in the comment section. So patient is having oculocutaneous albinism, hemorrhagic diathesis is seen, and there is some ceruloid material deposition occurring in the organs, internal organs. So what is this syndrome? If you have thought of Hermansky-Pudlak syndrome. You are absolutely correct. Very, very good. So basically in this, albinism is the skin finding, which you need to remember, in which there is going to be a defect in the tyrosinase enzyme. So next is a very famous and very well-known triad called as Hutchinson's triad, seen in the case of late congenital syphilis. Patients are going to have Hutchinson's teeth. So you can see here the notched central incisors. There's going to be sensorineural hearing loss, and there's going to be interstitial keratitis. So this is Hutchinson's triad. Hyper IgE syndrome, the name itself is very self-explanatory. So high levels of serum Ig will be there, and the patients are going to be usually the children having recurrent infections, and also in the skin there is going to be eczematous skin changes. As you can see here, the child is having eczematous changes. So next is a syndrome with vascular tumors, thrombocytopenia, and also bleeding diathesis. So what do you think is the syndrome? If you can remember it as Kasabach-Merritt syndrome, you are absolutely correct. Very good. Okay. So you can see here the patients are going to have this vascular tumors. Okay. So next is the Klippel-Trenaunay syndrome, in which there's going to be this port wine stain, also called as nevus flammeus, and venous malformations can be seen, and also limb growth can be inappropriate. So disproportionate growth can be seen in these patients. So here you can see the port wine stain, which is a capillary malformation, and also varicose veins can be seen due to vein malformation, and also the soft tissue and also bone overgrowth may be there, because of which limb length will be different in both the sides, right and left. Next is this condition, which is a syndrome again. I hope you might have read this in your gynecology. So there is going to be polyostotic or monoostotic fibrous dysplasia, and in the skin we can see the dark brown colored hyperpigmented macules, which are cafe au lait macules, and also there is going to be hyper functioning endocrinopathies. So have you thought of the diagnosis already? If you have thought of McCune-Albright syndrome, you are absolutely correct. Very good. The Melkerson-Rosenthal syndrome, in which patients are going to have the facial palsy, recurrent facial palsy, and there are going to be fissures over the tongue, which is called as lingua plicata. So next is granulomatous cheilitis. So patients are going to have the lips which are going to be swollen, and this is called as granulomatous cheilitis. So these are all seen in Melkerson-Rosenthal syndrome. Next is very, very important deep fungal infection, which is mycetoma, seen associated with farmers who are walking barefoot, and there are two types, geomycetoma and actinomycetoma. So in this there is going to be a triad of GST. I hope you all do remember this. So what is GST? G is granules are going to be there. So these are basically the colonies of the microorganisms. Next, S is sinuses. Next, T is tumefaction. Okay, so GST, goods and service tax, you can remember like that, is the triad seen in mycetoma. Next is nail patella syndrome, in which patients are going to have nail dysplasia and also patellar hypoplasia, and also they're going to be very important iliac horns. Okay, this is nail patella syndrome. So here you can see I am pointing towards the iliac horns. So these are the iliac horns, and this is the nail dysplasia which we can see. So next is a syndrome which was asked once in a JIPMER. Okay, so ichthyosis linearis circumflexa, patient is having the dry skin, and trichorexis invaginata, which is also called as bamboo hair. Okay, this is also called as bamboo hair. Next is atopic manifestations. So these three put together we call it as Netherton-Comel syndrome. It is called as Netherton-Comel syndrome, and in this there are two triads. So the triad which I told you just now is exclusively related to dermatology. There is one more triad. So it was observed that the patients are also going to have this generalized infantile erythroderma, and there is diarrhea and also failure to thrive. So these three are also another form of a triad which are seen in the Netherton-Comel syndrome. So remember, Netherton syndrome was a previous dermatology related question. Next is pellagra. This is very, very important, and I hope all of you know the vitamin deficiency associated with pellagra. If you know, put it in the comment section. What is the triad we are going to see? 3 Ds will be seen. The first D is the dermatitis, which is predominantly seen in the photo-exposed areas. Next is the dementia, and the third one is the diarrhea. And if it is left untreated, unfortunately, there is going to be a last D which you will be seen, which is the death. So have you answered in the comments what is the deficiency seen here? Yes, if you have thought of vitamin B3, that is niacin deficiency, you are absolutely right, associated with Castle's necklace. Okay, next is the primary systemic amyloidosis, in which patients are going to have, because of the amyloid deposition, macroglossia, that is very large tongue is going to be seen. And also there can be waxy nodules and plaques which will be deposited in the body because of the deposition of the amyloid. And also there is going to be carpal tunnel syndrome because of, again, the deposition of the amyloid, which is going to press on the nerves. Okay. Next is Ramsay-Hunt syndrome. I hope all of you have heard this in your ENT. So what is this? This is a herpes zoster oticus. This is herpes zoster oticus. Patients are going to have the facial palsy, and there will be vesicles in the ear, tongue and the palate, and also there is going to be pain in the ear. So this is the Ramsay-Hunt syndrome associated with herpes zoster oticus. Okay, so I hope this video is helpful. If so, please do remember to hit that like button, dear students. Next, we are going to see the Reiter's syndrome, in which we are going to see patients having a difficulty in seeing, peeing and also climbing a tree. So you can remember it as patients can't see, can't pee and can't climb a tree. What is the reason for that? Because patients are having this non-purulent arthritis, they cannot climb a tree, and they have conjunctivitis, so they cannot see and they cannot pee because they have urethritis. So this is the Reiter's syndrome, which is more better called as reactive arthritis. So this is another name, or this is the most important name which you need to remember, because Reiter's syndrome is no more used in the literature. Next is the Sézary syndrome, which is a leukemic variant of the cutaneous T-cell lymphoma, that is a mycosis fungoides. So in this condition, what is the triad we are going to see in this condition? Yes, if you remember the S, L and E, you can easily remember the features of the Sézary syndrome. So there is going to be Sézary cells in the blood. What are the Sézary cells? So you can see here, these are the atypical T lymphocytes which are having cerebriform nucleus, which are present in the circulation, and there is going to be generalized lymphadenopathy in these patients, and also patients may go into erythroderma, in which 90% or even more of this body skin is going to become erythematous associated with scaling, erythroderma. Okay, so this is a leukemic variant. This is a leukemic variant of the mycosis fungoides. Very important to remember. Okay, next is Sjogren syndrome. I hope you might have heard this in your ENT also. Patients are going to have a triad of keratoconjunctivitis sicca, and also arthritis can be there, and also dryness can be noted in the mouth, xerostomia. Next, Still's disease. Patients are going to have in the skin urticarial eruption. They're also going to have the fever and arthritis. So in the skin, you are going to remember urticarial eruption in the case of Still's disease. So here you can see these are the urticarial wheals. Next is the tabes dorsalis, which is important in the case of the syphilis. Patients are going to complaining of lightening pains, difficulty in walking, ataxia. So this is tabes dorsalis. So next is an important genodermatosis, in which there is going to be a triad, which we call it as EPILOIA. Epiloia, in which EPI stands for epilepsy, mental retardation. We can also call it as low intelligent quotient, low IQ, and adenoma sebaceum. So epilepsy, epiloia, it is characteristically seen in which genodermatosis? Put your answer in the comment section. If you have thought of the answer as tuberous sclerosis complex, you are absolutely correct. And this triad is called as VOGTS, Vogt triad. Next, we have the Wegener's granulomatosis, Patients are going to have the small vessel vasculitis, necrotizing respiratory inflammation. So basically their pulmonary system is going to be affected, and also kidneys in the form of glomerulonephritis in the patients of vaginous granulomatosis. So next is a triad, which we are going to have the atopic like dermatitis in the skin, microthrombocytopenia, and recurrent infections. And I will give you one more clue. This is associated with VASP gene mutation. Can you tell what is the syndrome? If you have thought of it as Wiskott-Aldrich syndrome, you are absolutely correct. So next is the yellow nail syndrome, in which obviously the nails are going to be yellow in color and they are very, very thick, and the patients are going to have the lymph edema, and there is going to be pleural effusion. So this is the triad which we are going to see in the yellow nail syndrome. Okay, so that's it, students. I hope this video was helpful. If so, please hit that like button. Do subscribe to this channel. Really helpful. In the comments, write down thank you sir, so that it will boost my morale. So happy learning. Sarvam Sri Krishna Arpanam Sarve Jana Sukhino Bhavantu.